Hello everyone. Today we will be seeing newborn reflex. Newborn reflex is a part of newborn assessment. Newborn assessment I'll be taking in another video. In this video there is just newborn reflexes. If you are a novice nurse, please don't try doing the newborn assessment and reflexes alone. Always be with an expert and do the assessment part. Moving on, what is a reflex? Reflex means something that happens involuntarily. So newborn reflex means something that happens without the baby's try. Healthcare professionals will be evaluating these newborn reflexes to know the neurological function and development. We will be moving on with the reflexes. We will be learning the reflex in 4 headings: the name of the reflex, how to elicit, what is the newborn's response, and the age of disappearance. The first reflex is sucking reflex. So you can see the first picture. You need to place the mother's nipple or finger in infant's mouth. So the baby starts sucking. From birth to 5 months, it is rooting reflex. You can see the second picture. Here the nurse needs to stroke the infant's cheek. Don't continuously stroke the cheek, then reflex won't be elicited. Once you are doing, then only you will get the reflex. The response of the infant is, infant turns to that side searching with mouth for food. Birth to 3 months you can observe. Next, extrusion reflex, this picture. The substance placed on the anterior portion of the tongue. So you need to place something on the anterior portion of the tongue. The protrusion of the tongue, you can see in the picture there is protrusion of the tongue so that there is a prevention of swallowing. It does not disappear. Next is glabella reflex. So glabella is a smooth part, this part of the forehead, above the nose and between the eyebrows. This part again. So here you need to slightly tap on the glabella region. The tap must be so smooth. You can see blinking of eyes and disappears as the brain matures. Palmar grasp. This picture. Place finger on the palmar surface of the infant's hand. The infant's hand grasps the finger. Birth to 6 months you can observe. Plantar grasp. Placing object beneath the toes. You can see the finger is beneath the toes of the baby. Curling of toes around the object will happen. You can see it from birth to 9 months. Next is pupillary response. Flashing light across the baby's eyes or face. Constriction of pupils you can see, and it persists throughout life. Next is Babinski reflex. So here you need to stroke along the lateral aspect of the sole across the plantar surface. From down we have to move up and towards the bigger toe. What you can see is fanning of fingers and hyperextension of the bigger toe. Birth to 12 months you can see this. When you are observing this, this is known as a positive Babinski reflex. If the child is showing a positive Babinski reflex even after 1 year, then it suggests a neurological problem. Till 1 year, Babinski reflex, positive Babinski reflex is a good reflex for newborn. From down, you need to move up towards the bigger toe. You need to understand how to elicit. Next reflex. incubation or Galen reflex. When child in prone position, you can see the first picture, child is in prone position. You need to stimulate the back lateral to the spine, side of the spine you have to stimulate. You can see in the second picture, flexion of the trunk towards the side of the stimulus. Where the stimulus, which side stimulus was given, that side the trunk will turn or flex to that side. Birth to 4 months you can observe. Next is Moro reflex, sudden dropping of the head. So at that time, the arms abduct, that means moves away from the body and move upward and form a C shape. You can see the fingers, the thumb and forefinger, how it has formed is, it has formed a C shape. Then after that, the arms flex and adduct will move close to the body. So arms abduct and move upwards and hands form a C shape. Then the hands will flex and abduct. From birth to 7 months you can see this. Next is startle reflex. Startle reflex is something very similar to Moro reflex. You have to make a loud noise when you are near the child. So here also, like Moro reflex, arms will abduct and move upward and then the arms will flex and adduct. Birth to 4 months you can see this. Next reflex is known as asymmetric tonic neck reflex or fencing reflex. This tonic neck reflex is asymmetric because both sides of the body it is not showing a symmetry. So when the baby is lying in supine position, turn the head to one side. It's not the body, you have to turn the head to one side. What happens is extremities are extended on the side of the body to which head is turned. Which side of the body the head is turned, that side extremities will extend and the opposite extremities will flex. You can see from the picture. Birth to 4 months. Doll's eye reflex. So here, turn neonate's head slowly to any side. So any side you need to turn the baby's head. The eyes do not move. So you can see here the head is turned but the eyes is fixed. That is known as doll's eye. So later on when the child's eyes fixation develops, it will disappear. So whenever you are seeing a newborn, have you ever observed the newborn's eyes? You may look like the eyes are uncoordinated or they may look cross-eyed. Initially, in the initial days, they will fix eyes on your face, on the mother's face. Then after few days only, they will be following a moving object. Like that, later on only fixation will develop. So until fixation develops, the newborn's eyes will be showing a doll's eye reflex. Next is step reflex or walking reflex or dancing reflex. So you need to hold the baby upright with feet touching the flat surface. The feet should be touching the flat surface. So you can see the legs bounce up and down as if the baby is walking or stepping or dancing. Birth to 9 months you can see this. Landau reflex. So with child in ventral suspension, you need to depress the head. You can see in this picture, this is what is ventral suspension. You need to depress the head. What you can observe is hips, knees and elbows flex. 3 months to 1 year, you can see this. So Landau reflex will improve the muscle tone when baby is on tummy and it will help the baby raise head and chest. If this Landau reflex is absent in 3 months to 1 year, that shows hypotonia or mental abnormality. Next is Perez reflex. With child in prone position, pressure is applied upwards along the spine from sacrum towards head. From the sacrum towards head, pressure is applied in the prone position. And this pressure is applied along the spine. What happens is infant flexes arms and legs, extends the neck, and the baby will be crying. Birth to 6 weeks, you can see this. Next is parachute reflex. Holding the child in ventral suspension and suddenly lowering towards the couch. Suddenly we have to lower the child. The arms will extend as if to protect from falling. 6 months to lifelong you can see this reflex. Neck righting. Turning head to one side. This is followed by turning of body as a whole. From 4 months lifelong you can see this neck righting. You need to turn the head, the entire body will be turned. That is known as neck righting reflex. Next is labyrinthine reflex. So placing child in prone position, so when the baby is 1 to 2 months old. And also after that, by placing in supine position in the later months, you can see this reflex of labyrinthine. The child will be lifting the head up. The age of disappearance is 2 months to 2.5 years. This is all about the reflexes. Once again, I would like to tell you one thing. If you are a novice nurse or a student, please do practice or see the reflex how experts are doing. Thank you so much. Please do subscribe to this channel for more videos.